Hello, everyone. I'm Bert Eichel, the health officer of Mobile County, and it's a pleasure to be with you this afternoon. Dr. Murphy is busy giving people vaccines and testing. COVID is very active in our community at this time. We have 459 people admitted to the hospital today. 52 were hospitalized in the past 24 hours, and unfortunately, 8 persons have died of COVID. The saddest part of this COVID experience is the people who are dying are not vaccinated. And that's one thing that you and your friends and your family can do something about. So, as we've had increased community activity, it's extremely important to one, get your mask out again, socially distance, and get vaccinated. The other one is don't rely on the vaccine protecting you against everything. So be very cautious right now with high community activity. Our city has announced that the Dolphin Street special event is not going to occur, and that is a wonderful uh, event, but should not happen during these times of high community transmission. So please, everyone, congratulate our city leaders on making a very good decision. There's always time to celebrate when we get through the COVID 19 experience, and it will pass. We have probably another 6 weeks or so of real, what Bert would interpret as high disease activity levels, and then it should go down if everybody will just do their part, mask, vaccinate, and don't take COVID for granted, please. We will get this back under control with a good community cooperation, which I know everybody can do because we've done it before. One of the interesting questions that's come in is that now there's a recommendation for a third shot, booster shot, for individuals who are actually organ transplants or severely immunocompromised. So for normal individuals, the single dose of Johnson Johnson or the Moderna Pfizer two shot gives significant immunity to both the alpha and the delta strain of the virus. There is a lambda strain coming along. We do not have any significant information about this Pfizer, Moderna, or Johnson Johnson immunity, but the assumption is it will give you significant protection against the next strain of COVID that's coming forward. The Delta strain is probably going to remain the dominant strain because it's so highly contagious, and we do not anticipate Delta going away anytime soon. So, really, as this COVID crisis continues to evolve, please remember that your prevention of having a case of COVID will help our hospitals. Hospitals, two of them are not able to do elective surgery at this time. I anticipate more hospitals will be ending elective surgery. The process of getting into an emergency room, if you have blunt force trauma from a motor vehicle accident or you slip and fall, if you fall off a ladder, you will have delay in getting that medical therapy because of COVID. COVID is consuming a tremendous component of our healthcare capacity. We have adequate ventilators, but ladies and gentlemen, you do not want to end up on a ventilator. That means that you're very, very ill, and the risk of death increases if you have to be ventilated. So please be cautious. It's better an ounce of prevention is worth a pound of cure. So please, everyone, use extra effort over the next 6 weeks to be cautious, get vaccinated. Do not gather with people outside your immediate family. If you want to go out and eat, consider sitting outside. There seems to be significantly less transmission in the outdoor area, but only if you have physical separation from people who are not known what their vaccine status. Also, we recommend that churches put their singing on hold good MMWR article showed that singing increases the opportunity for transmission. So, church leaders, let's maybe you can play the organ. You can have a soloist a great deal distant from the rest of the congregation, but strongly consider not singing while in church. Again, thank you everyone for what they're doing to help deal with COVID 19. I wish it could be over with, but as we've said before, no medical professional has said that COVID 19 is over, and we all need to exercise caution as this process moves forward. We will get through with COVID. We will probably have vaccines similar to we have flu vaccines, and we have to take tetanus vaccines, and our puppy dogs have to get their rabies vaccine. So this is something we will be able to prevent, but it's going to take everybody's effort to be willing to be vaccinated. Do not become a victim of COVID 19. Get vaccinated and wear a mask.